Hello, everyone. My topic for discussion today is Sustainable Development Goals and ending ECC as a public health crisis. In this presentation, we will be discussing what are Sustainable Development Goals or SDGs and their impact on oral care improvement. Following that, we will be discussing the integration of oral health services into primary healthcare centers, the strategies for oral and general health amalgamation for better patient care, the multidisciplinary approaches collaborating with wide range of healthcare workers, the focus shift to technology-driven strategies, and finally, the conclusion. Approximately 3.5 billion people worldwide are affected by oral disease, of whom 530 million are children suffering from untreated dental caries of primary teeth. Research has demonstrated that ECC is associated with nearly 123 risk factors. ECC has also been associated with local pain, infection, abscess, and sleep pattern. Now, Sustainable Development Goal Framework first launched in 2015 during the UN General Assembly and includes 17 universal goals and 169 targets. The SDG declaration emphasizes that to achieve the overall health goal, we must achieve universal health coverage and access to quality health care. Of these SDGs, the health goal, that is SDG 3, is to focus on good oral health and well-being. Unfortunately, oral health has not been considered under SDG 3. Lack of coherent stakeholders and policymakers are other barriers to implementing preventive approaches. Therefore, population-wide strategies with sustainable maneuvers are critical to evaluate practical, sustainable approaches to reduce the ECC burden globally. Hence, we propose 3 significant strategies to combat the burden of ECC. Number 1, integration of oral health services into primary healthcare centers. Number 2, amalgamating oral and general healthcare for better patient care. And number 3, multidisciplinary approaches collaborating with wide range of healthcare workers. Now, coming to the first strategy, when it comes to integration of oral health services into primary healthcare centers, we want to highlight these critical strategies. Establishing an integrated periodic dental screening in line with immunization schedule could be instrumental in implementing the first dental visit by year 1 or as soon as the first tooth erupts into the oral cavity. Second would be to focus on early diagnosis. One of the primary ways to achieve the SDG 3 on health indirectly relies on early diagnosis of disease entities. Similarly, we propose to encourage early diagnosis of ECC. Early signs includes enamel hyperplasia or enamel defects. There are 2 possible ways to achieve this: using MAC charts and practicing sustained anticipatory guidance approach. Now, MAC charts. It illustrates the various early patterns of enamel defect, demarcated and diffuse opacities on various maxillary teeth as a collage of pictures organized as incisors and canines. SAG or Sustained Anticipatory Guidance approach includes early first visits, parents' education, providing sustained anticipatory guidance, follow-ups, empowering parents, caretakers to self-report by using MAC charts and providing necessary early intervention. Now, this table illustrates the vaccination schedule in India and its possible integration with infants' oral health examination schedule. Now, if you see look into the table, you see the vaccination schedule for 9 to 12 months. During this time period, we propose that lower central incisors should be examined. During the measles, rubella, PCV booster vaccine, that time upper central and lateral incisors should be examined. At 16 to 24 months, when the vaccine schedule for measles and rubella 2 is scheduled, lower lateral incisors, upper and lower first molars, and upper and lower canines should be examined. Now, the second molar screening has to be facilitated for another schedule later when the second molar erupts. Now, this flow diagram helps to understand how integration of oral health services into primary healthcare centers can be achieved. Now, if you see, the primary healthcare centers can aid in providing education, awareness, training, community engagement, integrating the dental visits of the infant with the immunization schedule, providing preventive measures like early intervention protocols and sustained anticipatory guidance, helping healthcare professional or non-dental professionals, mothers or parents, caregivers, primary healthcare workers to help them detect caries or ECC early through MAC charts. Now, the second strategy is amalgamating oral and general healthcare for better patient care. If you see, we have 4 approaches to this. First, by bridging the gap. Now, bridging the gap between oral and general health is very important and the first move to achieve this. Second, health in all policies. Now, we need to integrate oral health in all policies. This is what we propose. The third one is the proposed SDG framework. Now, this is a schematic framework of possible ways to integrate general health with oral health and the 17 sustainable development goals. I will be showing the schematic framework on the later slides. And the third is to educate parents and non-dental professional of how ECC can impact on physiological and psychosocial being of that infant. Now, if you look into the slide, you see these are the 17 sustainable development goals proposed by WHO. Of this, SDG 3, which is good health and well-being, is for health. Unfortunately, like I already mentioned, oral health is not included here. And this is another diagram which was again proposed by WHO. And this is to show the SDG 3 and health-related linkage to other SDGs. Now, what we propose is we propose a possible oral health linkage to 17 SDGs, as you can see in the diagram. And this can be achieved by inclusion of oral health under SDG 3 or health goals. Second, by establishment of childhood caries under non-communicable disease. Third, amalgamation of oral health with universal health coverage. And fourth, by embedding oral health into all health policies. Now, this is what we are talking about, and this is what we need to reiterate and reinforce to the policymakers that oral health must be integrated into general health policies. Okay, now you come to the third strategy, which is multidisciplinary approaches, collaborating with wide range of health workers. And this can be achieved by developing effective primary healthcare teams. Lessons from successful international approaches can be taken. For example, if you see cavity-free at 3, this is a CF3. This is a program which was run in Colorado. And this program helps to train a non-dental professional on how to do caries risk assessment, how to examine teeth, how to what to look for in the tooth, etc. And a similar program was conducted in Ramachandra, which is Smile Train Oral Health Project. It was done for infants with cleft lip and palate. And in this, we provided sustained anticipatory guidance approach. And we can also achieve multidisciplinary approach by collaboration with other healthcare specialties and monitoring universal oral health coverage across nation with SDGs. Now, this is another flow diagram showing the same thing as we discussed. Now, these are national level oral health programs or missions, which holds good examples of how we can achieve our initial, missions, which help us understand that it is achievable. Now, in Scotland, if you see, there was a program called Child Smile. As a result of this program, it has been reported that 60% children up to the age of 7 years have no noticeable decay. In Brazil, Smiling Brazil National Oral Health Program, or NOHP, this program also utilizes a vaccination campaign to introduce good oral health habits for pregnant mothers and newborn infants. In Hong Kong, they had a program called CECCRe, Club Children Oral Health Project. This large-scale school-based oral health project aims to screen all preschool children for ECC. Now, another program in United Kingdom conducted by National Health Services, and the National Health Services provided free oral care in England and other developed nations such as Scotland, Wales, and Northern Ireland. In India, there have been programs related to health missions, like Mission Indradhanush, Universal Immunization Program, and Rashtriya Bal Swasthya Karyakram. But unfortunately, these programs did not have oral care as a mission. In Taiwan, you have health insurance. This health insurance system provides topical fluoride application for all children under 6. In addition, other benefits are also provided during this program. In Australia, National Oral Health Plan 2014 to 2024 is a blueprint that ensures healthy teeth and mouth among Australian children and adults across different sectors and jurisdictions. In China, National Program for Chronic Disease Control and Prevention. They help promoting early intervention in community health services centers and township hospital. In Thailand, Sweet Enough Program. This program started in 2002, which was later adopted as a national policy to stop added sugar in infant formulas since 2006. Now, as we talk about sustainable development goals into oral healthcare, we do realize there are some challenges underway. Now, challenges can be of 4 different types. For example, in lack of financing can be one of challenges. And in this, because of limited coverage on dental care, could cause inequality in access to dental health services, leading to disparity in oral health. Second challenge could be a lack of proper insurance. Now, make factors such as politics, governance, national health schemes, education, regional oral health leaders, trained personnel, socio-demographic index can constrain the implementation of this solution-based framework. Now, the third, there can be instability of resources as well. For example, when we had COVID, the sharpest economy slowdown in the past 8 decades with rising inflation and food insecurities, war, and during the time of COVID, caused instability of resource in low and lower middle income countries. And this posed a challenge in mobilizing financial resources towards dental healthcare services. Now, the fourth one, which is the most important one, is the lack of human resources. This can also be a major challenge. And increasing in the number of dental schools has led to increase in the number of dentists, but sadly, the availability of dentists in rural areas still sparse. Also in LIC, that is lower income countries, very few dental schools exist, and hence the availability of dental personnel is extremely low. Thus, providing healthcare to all is one of the, it's challenging because of these factors. Now, I would like to conclude by focusing on the take-home messages from this presentation. Now, what we propose is, given the ratio of dentists to population, especially in a country like India, where the ratio is quite not balanced, So we propose that a patient-driven, that is shifting the focus from treatment or minimally invasive to preventive patient-driven is critical to achieve an exponential outcome from such strategy. So in by this, which I mean is we educate the parents, caretakers how to diagnose and self-report, and I think that is achievable. And they report to us the moment they see early signs of ECC. Then what is also important to the culmination of oral health with NCD, universal health coverage, and SDG3 are key steps, I should say. And early intervention and SAG is the two good approaches to or strategies to to facilitate this kind of SDG and to improve the global burden of ECC. Now we also need political aid, so political mandate and proper government governance using the common risk factors approaches and alignment of ECC SDG targets with emerging political opportunities can further aid to remove the regional disparity. And while all these are strategies to achieve that, we also feel that surveillance and monitoring is very crucial. Surveillance and monitoring of demographic and health-related indicators in SDG era will aid in attaining sustainability. And now, as we see, most of the population has mobile phones, smartphones with them. And so mHealth services can be used for dissemination of education or other stuff. And this can be done by using tailored cutting edge mHealth services to curate to achieve the sustainable targets across nation. This is what we propose overall. And this is the paper which was published in Frontiers Public Health. And if you want to read the entire paper, please go and have a look. And thank you for this undivided attention. And I hope each of us should work into sustainability of oral health care to reduce the ECC burden in the country and globally. Thank you so much.